Fillers are a group of products that have been developed to plump up the skin. Essentially, they are chemically inert, and the point is to fill space. That's why they're called fillers. Plump up areas of the face, such as the mesolabial folds and the nasolabial folds, as well as the submental creases, and they tend to work very well. The most commonly used fillers right now are the hyaluronic acid fillers, such as Juvederm and Restylane. They've been around for about 5 to 6 years, and they have a very good safety profile, and they last for a good year or year and a half. Initially, the research has shown that they would last for about 6 months, but we found with experience that if it's done properly, it really lasts significantly longer than that. That's the most commonly used fillers. An older variety of filler is collagen. We don't tend to use that very much anymore because there are some people that are allergic to collagen. Therefore, testing is required, and that, in addition to taking additional time, increases the risk not only the first time but down the road. So we don't use that very much anymore, but it is still available for people that like it. And collagen tends to last more in the order of 3 to 6 months. Additionally, there are newer fillers. One is called Radiesse, which is hydroxyapatite. Hydroxyapatite is also chemically inert. It's naturally found in our bodies, and therefore the risk of an allergic reaction is zero, and therefore no testing is required. It has a slightly longer life than hyaluronic acid, generally 18 months to 36 months sometimes, and it tends to be used more for people with deeper creases. You'll see a significant improvement right away. There is additional improvement that it develops over a period of weeks to months, and that varies depending on the location and which filler is being used, but there's significant improvement immediately. The downtime is variable depending on the patient and depending on the product. For patients that are on medications that increase their likelihood of bruising, such as Plavix or aspirin, there may be some bruising that can last for a week. But the typical patient generally has very little bruising, very little swelling, even an hour later. And that for some of the products, there is a little bit more bruising, such as Radiesse tends to have a little bit more bruising because it's delivered through a larger needle. But with Restylane and Juvederm, the downtime is really very minimal, if at all. Many of my patients typically go back to work after they've had the procedure done, and they put some makeup on, and they're fine. Since fillers are injected with a needle, I would recommend it be done by a physician, and more importantly, by someone who has experience doing it. There's a certain amount of experience that is required to do it, and therefore the first time it's done by a physician may not be as pleasing as the 100th or the 1000th time it's been done. And so I think asking questions when you go to see someone about having the procedure done, such as how long they've been doing it or how many times they've done this procedure, those are reasonable questions and are appropriate.